Hello everyone. I get some questions from dentists, even associate dentists, about cantilever bridges. Like they will want to prep like a 1.5 or a premolar and say, there is a missing another premolar, can I put a cantilever pontic there? Or they're prepping a crown on a molar and there is a neighboring premolar missing. I say, can I put a cantilever there? And usually I will share my thoughts, but I thought I will make a video about it. And again, my reference for that was the best book I learned prosthodontics from was an implant book by Dr. Misch, the late Misch, and it's really he has some brilliant textbooks on dental implants, prosthodontics, and you can learn good value prosthodontics there as well. So that's my reference. Probably there's other reference I wouldn't know about because I'm not a prosthodontist, but if you know the reference, you will know what I'm talking about. But first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. And you can check my details below for credibility. I took from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 14 years. So cantilever pontics or cantilever bridges. I would like to, rule number 1, avoid cantilever whenever possible. Whenever you can avoid cantilever, try to avoid if you can. But if you have to, of course, they are very technique sensitive in the terms of occlusion. So which means you need to have the ideal patient. If you have a patient with a deep bite, patient doesn't have good canine guidance, doesn't have good incisal guidance, does have missing posterior teeth, patients who has parafunction habits that's not controlled, those are not good indicators for cantilever bridges. Also patients with short crown to root ratio as well, so they have very short roots. They are not good candidates for cantilevers. So for me, I would place cantilever bridges or pontics on upper laterals, so missing 1, 2, or 2, 2, again on ideal occlusion, not on a deep bite patient. Missing centrals, again in an ideal occlusion, so I would cantilever over 1 central to carry another central. Lower incisors, so missing lower lateral or missing lower central incisors. I wouldn't put any cantilever bridges on premolars, except we don't do this nowadays, but back in the days we used to, let's say you have a missing 4 and you're doing a bridge from 5 to 7, so you have 1.7, pontic 1.6, 1.5 abutment. You can put maybe a pontic on 1.4 as long as you have good canine guidance and this pontic out occlusion, but we don't do big bridges anymore now with implants. But I will put on laterals, upper laterals, upper centrals, if the occlusion is perfect and ideal, minimal overjet, minimal overbite, minimal parafunction, good crown root ratio, not short conical roots. Lower incisors. I wouldn't place any pontics, cantilever pontics on premolars at all. And also try to keep your pontic on the mesial, not on the distal, whenever possible, because all the forces from the back are higher than on the front of the mouth. So forces go from the height on the distal and get smaller and smaller towards the mesial. So I tend to avoid any cantilevers on 1.4, 1.5, or upper premolars and upper molars and lower premolars and lower molars. That's, again, if you know my other video about over-engineering my dentistry, again, I would like to do dentistry that will last for a long time with minimal complications whenever possible. The only distal cantilever would be an exception, would be for full arch dental implants, like the all-on-4 kind of treatment where you can place 4 implants, and because the whole bridge is supported rigidly by 4 implants, so you can have a small pontic. Again, try to minimize the pontic on the back as well. You don't have a massive big cantilever on the distal, really short, very short cantilever whenever you can. Of course, if you can put all-on-6 or something to avoid cantilever altogether, it's even better. But full arch implants, that's when I can place distal pontics. So I wouldn't place any sort of cantilevers on molars or premolars, and except distally on full arch implants. Lastly, if you're doing like a Maryland bridge, like a bonded wing, let's say you have a missing upper lateral or missing central, you want to put a wing on the canine or a wing on the central or a lower incisor as well. My way of doing it is, number 1, I would avoid fix. It would be a cantilever. The reason I will avoid fix or 2 wings, because you've got 2 teeth that are moving independently and you can risk debonding, usually debond in 1 retainer or 1 abutment, and patient will not know that it's debonded and they end up getting caries on that area and decay. So I tend to put it on 1 tooth, so at least the pontic is moving with the tooth. So the risk of debonding is a lot less because the movement is going with the tooth. Keep the pontic for any cantilever out of occlusion whenever you can, whenever possible, especially on lateral excursion as well. And if I'm doing a zirconia, layer zirconia, I will ask for a hot bond, which means the fitting surface of the wing of the zirconia is treated as ceramic, so you can bond it as you would bond porcelain veneer, for example. So if you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, and I will notify you when more videos are released. Thank you so much for listening to me. It means a lot to me.